Dear healthcare professionals, in this video, I'm going to share with you an interesting case. This case is interesting because I have not seen this problem previously in my more than 25 years of clinical practice. And I thought it to share with you all. A 62-year-old man who presented to hospital emergency with history of abdominal pain and vomiting within 30 minutes of consuming a meal. He was brought to hospital emergency and after initial management, he was shifted to intensive care unit. Patient's daughter gave a very typical history of food consumption that after having a meal prepared from bottle gourd, he felt unusual and bitter taste of prepared meal, so he did not continue with that meal and within next 30 minutes he developed pain abdomen and subsequently vomiting. His initial heart rate was more than 120 per minute regular, respiratory rate 24 per minute and blood pressure 70 millimeters of mercury systolic, and he was in shock. On examination, the patient was conscious but confused with pale, cold and clammy skin in extremities. Systemic examination revealed abdominal tenderness. In intensive care unit, intravenous fluid resuscitation continued. He improved within next 5 days and shifted out of ICU. This presentation was mimicking abdominal sepsis. So, what happened to this patient? Let's understand. Bottle gourd or other members of the Cucurbitacea family, including zucchini and cucumber that tastes unusually or extremely bitter as in this case, can cause poisoning due to high levels of a toxic compound called cucurbitacin. These naturally occurring compounds are present in all gourds but usually in very low, safe concentrations in edible varieties. Environmental stress, such as high temperatures, drought, or poor soil quality, overripening, can cause the concentration of cucurbitacins to increase to toxic levels in otherwise edible varieties. Cucurbitacins are not destroyed by cooking, so a bitter taste will persist even after the gourd is cooked. Symptoms of cucurbitacin toxicity typically have a rapid onset, often within minutes to an hour of consumption. They can range from mild to severe and in rare cases, can be fatal. Common symptoms of poisoning include severe abdominal pain and cramps, nausea and vomiting, which can be bloody, diarrhea, potentially with blood, hypotension, which can lead to shock, dizziness and weakness and in some cases, liver or kidney function impairment. Cucurbitacin increases capillary permeability, leading to hypotension and capillary leak syndrome, mimicking septic shock. We are highlighting this case for the 3 important reasons. Firstly, as most of the available case reports about bottle gourd poisoning is related to consumption of its juice and not related to consumption of meal, as likelihood of ingesting more poison lies with juice and not with the meal, particularly if the meal is not consumed after initial few bites, but in this patient, it was after meal and interestingly, patient had only few bites. Secondly, it is a concern that even clinicians might not be aware of this entity, and they should keep this entity always in mind if patient presents with similar history or symptoms. And thirdly, not only bottle gourd but other members of its family like zucchini and cucumber can cause same type of illness. Toxicity from bottle gourd, a commonly consumed vegetable, may be more prevalent than reported. Hope you like this case. Please share this case with other healthcare professionals.